Yeah, please, thanks.
So, folks, if you can take a seat, we're going to get the session started. It's really fabulous to see such a room full of people. My name is Margot Parks, and I am a member of the Health Research Institute on the Leadership Council. You're going to hear more from me shortly, but I'd like us to acknowledge that we are about to launch something really exciting here, this new seminar series, and as we should do every day on this campus, but especially when we are launching something new and important, we are really pleased to be able to be welcomed here today by Elder Violet Bazoki. And so we're really, well, let's start with her just welcoming us to territory. So Violet, please.
Yeah. So could I just start with the prayer?
Yeah, now we're on our
I thank you, Creator, for granting us another day. Creator, ask for blessings for everyone gathered here today. Blessings for our homeless and street people, our youth and our elders. And Lord, I ask for special blessings for our presenters. Keep them in good health and keep them safe so they can continue the good work that they do for my people. Yes, I ask in the name of Lord. So on behalf, I welcome you to the City Territory on behalf of our Chief Dominic Frederick, our councillors Vanessa West, Clayton, Clay anyways, I can't remember that, and Shirley Festerson and Darlene Logan, our elders and youth of our community. I welcome you onto the traditional lands of the city tonight. Welcome.
Thanks, Violet. So, Violet, thank you so much for being here. Violet we really appreciate her coming up from the fire pit. She is going back to continue the really important work that she does there in Indigenous health and otherwise. So, thank you for being here very much.
Do you need help going to the car? No, I can get you.
That's Donna's job.
Yeah, Donna can.
Can you walk? Thank you. So again, a very, very warm welcome to everybody here today. My name, as I mentioned, is Margot Parks, and this for me is actually it's a big day. This seminar, this panel, this launch of this new opportunity to have conversations about health research on campus is really exciting for me. I'm a faculty who's been here from 2009. I'm originally from New Zealand, and not only is the broader themes of health research really important to me personally in terms of my own work as somebody who began as a doctor but has worked in a number of different fields in terms of my own research interests, and that brought me here as a Canada Research Chair in Health, Ecosystems and Society. And the three panelists we have here today are people that have really made a difference to me in understanding health research, and I'm delighted that they will be our speakers. We're going to come back to our speakers very shortly, but because this is a first, and because this is the launch of the Health Research Seminar Series, we do need to just make a couple of acknowledgements about how this has come to pass and to really welcome you to be part of this ongoing conversation. So this is an initiative that has launched particularly as a result of a decade or so work that led to the establishment of the Health Research Institute. And the Health Research Institute at UNBC is creating a space for the kind of cross-cutting health research conversations that we know we need to have if we're really going to fully embrace the health needs in northern BC, but also to progress the kind of work that we know needs to be done to improve the health and wellbeing of people, Indigenous peoples and other peoples in the north, and also to profile the kind of fantastic work that's being done at UNBC among ourselves. We know very well that we have fabulous profs and researchers here, and often they present their work elsewhere. In fact, this panel has people lining up to see them elsewhere, and it's really important that we have these opportunities to hear from our faculty and our colleagues amongst ourselves. So you are, as members participating in these Health Research Institute seminar series, you're going to see a fabulous array of topics because the Health Research Institute covers a whole range of topics. And so we really do need to acknowledge that there is a group of people that came together to bring this seminar series to life. And this is actually only part of them. There are groups across campus, but we've had a series of meetings, a key one in the summer, where groups with representatives from across these schools and faculties, as well as the very clear mandate from the Health Research Institute Leadership Council that it's time to do this. And I really particularly want to acknowledge Sarah Gray and Chelsea Peltier, and Rachel Wells, the research manager at Health Research Institute, who have put our heads together, come up with our first array of speakers, and we're going to be up for a really exciting semester, and it will just be the first of many semesters. So we have a schedule now monthly for health research presentations each month. For this semester and next semester. We'll probably be taking a break over the summer, but as part of the health research community here at UNBC, you can really start factoring this into being a part of the culture here. So it's really exciting to be bringing this together. And before we begin, I just wanted to ask Martha McLeod and Henry Harder are co-chairs of the Health Research Institute, but just a couple of words to set us off.
Hi folks, I'd like to welcome everybody here. You might wonder what the Health Research Institute is. And the formation and the character of the UNBC Health Research Institute is quite different. It is an opportunity, it's more of a network, ability for all individuals, all faculty and researchers and students who are undertaking some form of health research to be able to belong with a very open membership kind of opportunity. Just go to the website and sign up so you'll get all the information. And the kinds of research that goes on here at UNBC we cover the 5 streams within the Health Research Institute: biomedical, clinical, health services and policy, the population, social determinants of health kinds of research, and Indigenous health research. And so that range of research, many of which you find projects will be overlapping, are all undertaken here at UNBC, and you will find people who are doing research in all of those areas. And over this seminar series, we'll hear from all of those areas. Another sponsor that I'd like to just acknowledge as well, particularly relevant for today, is the National Collaborating Center on Aboriginal Health. That national center, which is one of the centers of the Public Health Agency of Canada, is very important part of the fact that it is at UNBC. It's the only university that has the center absolutely grounded within it, I believe. And Margot Greenwood is the scientific leader. And you'll see all sorts of very important and very useful information here. And it is, people are up on the 3rd floor of the admin building, and Donna, I think, will be open to talking to you further very specifically in there, and Margot, no doubt, to talk about. So thank you very, very much for being here. We are very fortunate to be able to begin with today. Thanks.
Thanks, Martha. So I also need to acknowledge that we do have people online that are participating and that couldn't be here with us today. They don't necessarily have their cameras on, but a greeting to the people online. And we have, I think, Shani, you said there was 4 or 5 there. And we're also, for those people that are online, we have an exciting crowd of probably 50 or 60 people in here. So we're really looking forward to having this opportunity for a panel. It is important that I give you this taster because I know that some of you may have to head off earlier. So certainly it's really important to plan ahead for these sessions regularly, monthly, on a Tuesday. And importantly, one of the reasons we're having these sessions on a Tuesday is to dovetail with the School of Health Sciences Master's MSc in Health Sciences. So this is an important part of the graduate seminar for that program. And so we are really working and encouraging ways that this seminar, this health research seminar, will also integrate into courses. And there's real interest from the nursing program and other programs for people to be able to tune in after the fact, to watch the sessions online when we get agreement from the presenters, and to be able to really have this as a resource and a statement of the exciting research that's happening at UNBC across those different areas that Martha mentioned. And I'm going to leave this one up online. For those of you online, you can go to the HRI website to see where all the information is, the upcoming seminars, and start factoring that into your planning. So with that, I'm really, as I mentioned, really delighted to commence this panel with this important session. We have three fantastic colleagues here on this panel. As I mentioned, and I don't think I'm overstating it, these are three people, researchers, who are probably, well, they have been extremely influential in me still standing here in Prince George as a Kiwi from the other side of the planet, which since 2009. Not only because they have been excellent colleagues and mentors, but they have prodded and pushed me to think in new ways about what research is, and particularly in the context of Indigenous health. I am still learning. I'm always going to be a student, but this is a big learning journey for somebody who comes from another colonial entity, New Zealand. My experience here in Northern BC has taught me a lot about where I'm from and what it is that I need to do as a Pākehā settler from New Zealand, now living in Canada, to think and learn and act in a way that is genuinely furthering Indigenous health. So I am delighted that we are opening this seminar series with this panel. These people in this time at this place is a very exciting moment for me. It doesn't happen often. So I'm going to begin just by very briefly introducing the panel. The way this is going to work is we're very purposefully having a conversational panel today. We're not having some big research presentations on PowerPoints. We're having a conversation about important issues. And that's going to go with 2 rounds of questions to our panelists. This will be an emerging conversation, knowing the people on the panel. But we have an overall plan. You're going to hear from each of them twice. So you're not going to be able to just have one block and then run away or otherwise. We are going to hear from each of them twice, and we're really eager to come back to you as we end up the discussion for some good questions and some conversation about the kinds of issues. I can guarantee that you're going to probably leave with more questions than answers, because these are long journeys of learning and exchange, and I'm really delighted that these three are here to fuel that. So I'm going to take my seat. What I'd like to mention to the people online is that when we come around to the questions, we may be able to field a question from online. We have somebody watching the questions. And if there's any real problem with the audio, then we have someone that will be waving at us and we'll be trying to figure it out. But I think we're working pretty well for now. So I'm going to begin. We have 3 colleagues here. I'm going to begin just with the affiliations. These people have many hats. And we already had an introduction from Martha with the National Collaborating Centre for Aboriginal Health. And I really, really want to encourage those of you who are not familiar with NCCAH. This is a gem in our midst. And it's been championed by Margot, who is the academic leader for the National Collaborating Centre for Aboriginal Health. But Margot is also probably the first Vice President of Indigenous Health on a health authority in the country. And she is championing an incredibly important leadership role within Northern Health as a member of the executive and transforming the way in which Indigenous health is addressed within a health authority. But she is also, she is also a professor here at UNBC and has championed work in the School of Education and First Nations Studies as an active member of the Health Research Institute Leadership Council, as a mother, a grandmother, and extraordinary person. So we're really glad that Margot's here, which we didn't know if we could pull off, and it's very exciting that Margot's here. So that's Margot, a taster, really, and likewise a taster of Henry, who is the Dr. Donald B. Ricks BC Leadership Chair in Aboriginal Environmental Health. Henry Harder is also, when I first came to UNBC, Henry was my boss, and that has been a real pleasure. He has been an extraordinary mentor and colleague, and his transition from being one of the founder of the professor and chair of the School of Health Sciences has transformed that school, now chaired by Dr. Shannon Wagner, but with Henry's leadership has really been an enormous platform for UNBC to champion health research. Henry and I are working very closely on a number of colleagues, and I continue to feel greatly privileged to be working with Henry, and really delighted that he's on the panel today. And then I have right here Dr. Sarah Leeuw, and I can blame Sarah for me being here because when I was considering coming to UNBC, she did the hard sell. And she was right. She said it would be a fantastic place for me to come and work. She said there would be great colleagues. She said that there would be so many things for you to live and learn and discover. And she has proven right, and swim and run and explore. But Sarah is also another extraordinary colleague who has been championing a very, very important interface, particularly at the interface of Indigenous health and arts and creative methodologies. Sarah is a very well-recognised cultural and critical geographer who is also a well-known published poet who has been awarded for her poetry and her creative non-fiction writing, and she continues to probe our understanding and to challenge us to think in different ways around Indigenous health. We have an amazing panel here. We could sit here for days, but we are going to begin just by hearing from them. So we're going to start the conversation with Henry, and Henry knows that the first question that we wanted to hear from each of our colleagues is we really wanted to just ask the question of what are some key reflections and elements around your journey in the space of Indigenous health research? So Henry, thanks for sharing those thoughts.
So I have an hour to address that question?
Yeah. Go for it.
It's interesting starting with the biggest question possible. Before I answer that, or try to answer that at least, I just want to say a couple of things in terms of my overall background so that you know where I'm coming from on this. So I'm an Indigenous male. I'm privileged to sit with the Bear Clan of the Lake Babine Nation and have been involved with them for about 15 years now. I am 50%, well, I don't know, some percentage, roughly half Indigenous and half Russian Mennonite, so it makes for an interesting combination at times. And part of my journey has been my own exploration around that background and trying to determine where I fit. And so things like identity issues are really big for me. And is Jessie here? She's probably not here. No. So I have a doctoral student who's working on that topic, and Jessie and I, as we discovered the other day in a 10-minute meeting that went an hour and a half, we can talk about this for a great length of time. I'm also thrilled to be here with these three individuals. Margot introduced us very nicely, and I always feel like I should crawl out of the room when I'm introduced like that. But if you know the three of us, especially, and Margot as well, you know that there's no way there's only going to be 2 rounds. And that what we were told to talk about probably isn't going to happen. So anyhow, with that, it's a tough question to answer, actually. I came to, 16 years ago, I came to UNBC, and I was recruited to start the Masters of Arts in Disability Management. And then that morphed into recreating the Master of Science in Health Sciences, and then that became creating the Bachelor of Health Sciences, and that became creating the PhD in Health Sciences. And next thing you know, it's 16 years later, and we have about a cohort of 400, like 400 students roughly, Shannon, undergrad, and about 40 or 50 graduate students. So it's really a remarkable journey. But in terms of, so that's been the health side, and I'm a clinical psychologist by training, which is a critical piece to my research component. Psychologists are trained to look at individuals, but not trained to look at communities. And I was always uncomfortable with that in psychology, and always asked questions around what happens to other people that are involved with this individual. One of my first jobs was working for a kind of funny acronym. It's called BEEP, or was called BEEP, B-E-E-P, Back Education and Evaluation Program at Workstate, BC. And they bring people from all over the province in who have chronic pain, low back pain. They treat them in Richmond, or at that time they did, and then they send them back home. And then they wondered why there was a high recidivism rate for these people, which was bloody obvious to me, but everybody else would not have no idea why that happens. So when I came here, I had this opportunity to get more involved with community. I also was in, as a clinical psychologist, suicide intervention specialist down in Delta, and worked with adolescents there for many years. And I actually wanted to escape the suicide world when I came here, because it can be quite daunting and very draining emotionally. But it didn't work out that way. I think one of the first people I met with was from CSFS, Carrier Secondary Family Services, asking me to get involved in a grant application that looking at youth suicide and looking at prevention from a culturally specific perspective, which I did, and we got the grant, and it's been working with CSFS ever since. How much time do I have? So that really got me down this road. And then what's been happening for me is in psychology, it was all quantitative research. So when I graduated in psych, you weren't allowed to do any qualitative work. It was just not allowed. And in fact, I was one of the first people with a master's in my master's at UBC that was allowed to do kind of like a qualitative quantitative mix. Now, I wouldn't call it mixed methods because it had to be quantitative, but you could have a little bit of a qualitative element as long as you quantified the qualitative. So it was, that kind of thing that was going on. And I did the same thing with my doctoral work. So I feel like I was one of the first to push that through. And there've been many since, so it's much better than it used to be. But over the years now, I feel like we're doing the same thing with Indigenous research methods. So some people just figure Indigenous research is just relabeling other kind of terminology and things within the research paradigm. And I've really been working hard at trying to get people to understand that Indigenous research is different than just some version of qualitative work. And about, 3 years ago, I was given the opportunity to take this research chair job, which is in Aboriginal environmental health. And I'm very interested in the impact that repeated exposure to environmental change, including resource development, what impact that has on people's health, in particular their mental health. So Margot alluded to the fact that we're working together on a grant called ECHO, Environmental Community Health Observatory. And it's a large network across Canada, team of 60, like you said, researchers. Mm-hmm. So it's quite big, and it's been very exciting to look at some of those issues. I find that my intersection with a lot of communities starts because they have environmental concerns. So they may be worried about toxicology of certain products, water, berries, animals in their area, that kind of thing. And what I see happening in the communities is that has been having a negative impact on their overall health, and certainly into what I would consider the mental health or the spiritual health. Mm-hmm. So I'm trying to talk with people about their spiritual health without invoking any religion when you do that. And that's a particularly difficult thing because of for us, I think in this area, with the impact of Catholicism over the years. But I don't mean spirituality as the church defines spirituality. I mean that connection with the land and the animals and the environment that we're in, and how important that is to having a healthy person and a healthy community. So maybe I'll stop there.
Henry, thank you. Yeah, and part of what we're wanting you to get a sense of here is just the scope and range of people's experience as researchers, and that this is not some fixed path. We're also recognising that research means different things to different people. So Margot, I'm going to go to you next to share whatever it is that you would like on this question of a journey or a pathway in Indigenous health research.
First of all, let me say thank you for coming today, and thank you for the organizers for inviting me to be a part of this. It's a rare opportunity. I get to actually speak at UNBC in a plenary like this, so miigwech. I want to say that I am a Cree from Treaty 6 in Alberta, but I've lived most of my adult life in British Columbia and here in northern BC. So I have deep roots here in the north, as I do at home in Alberta, in my own territory. I want to begin then, having said that, I want to begin by recognizing the traditional territories and ancestors of the Lheidli T'enneh people and thank them for allowing me to be in and live and work in northern British Columbia. I'm grateful for that opportunity, and I'm reminded all the time that this isn't, that I'm a visitor here in their territory, even though I've lived here a long time. And I really want to acknowledge the opening prayer and welcome. It's always nice when you go to that space where you just kind of listen to someone welcome you and say kind words on all of our behalf. So it's a gentle place and a gentle way to start. And I always appreciate that in any meeting that I'm attending, because it doesn't always happen, not in the venues I'm in. So I took this question from a rather personal perspective, so I'm going to share a couple of personal things with you. And as Henry's already said, it's huge. I mean, I think each of us could sit here and talk forever. So I'm going to try to hit some high points that I think might be of relevance and give you some sort of understanding of the kind of work that I do. And I'll talk about that in the second question more, but it'll give you the context and sense of from where I come. So I wanted to first begin, and I hope these don't sound too disjointed, but I came from a family who really valued education. And I see that value, especially today nationally and national policies, and we all know that we're in a new era of reconciliation and all of those good things. And certainly the emphasis being placed on education is huge. I also hear that in many of the communities, in First Nations, Inuit, and Métis communities across this country, the importance of education. So it's no surprise to me. I can really resonate with that because that was in my family too. And I think, without speaking for everybody in the country, but certainly speaking from my own place, oftentimes education was viewed as a way of being successful in the world. Education was viewed as bringing with it opportunity. And for many of our people, we're marginalized, high rates of poverty. I mean, we are the poster child for inequities in terms of burdens of health and on most socioeconomic and other factors. So education was really seen and is seen, and certainly was seen in my family, as a way toward opportunity, to increase our lot in life, if you will. But you ask yourself, at what price is that? So that's a question that I often grapple with in research, and I'll talk more about that later. I don't want to go down that rabbit hole right now, or we'll be there forever. So know that that for me, as a person and from my family and from my community, that there was a high value in education. I never had those opportunities right out of high school to go right into university. I didn't go into university till later in my life. I didn't get the opportunity, well, never had the money, and all of that, those realities that many of you are facing. And so I didn't go till much later. And I remember when I started in a program that was a 1-year certificate in early childhood education. Because I really loved children and I really thought, I can do this. But I never had a lot of confidence in myself. I thought, well, I can probably do this, but I never saw myself going to university. One, I didn't have the funding and the resources, and two, well, I didn't really know if I was very smart or smart enough to do it. And that's the truth. But something, one of the mentors along my way, and I think this is one of the points that I want to share with you, is mentorships in these journeys, is I had instructors and teachers in those colleges that really believed in me and really showed me that there was opportunity. And that I had to have the courage to take it. And I think that's another piece that happens in our journeys as we move along to the places where we see ourselves as researchers. And that's a whole other conversation. But thinking about that, as I progressed, I went on to do a bachelor's, master's, and PhD. But throughout those journeys, especially starting in my master's and part of my bachelor's degree, I was also very connected to community. And I had the privilege of having elder teachers that walked us alongside me as I was walking in these institutions of higher learning. That was a rare and real privilege because I have a friend who said her parents used to say to her, well, you go to those classrooms, you learn what's going on, and then you come back and tell us. So I would go to my classrooms and I would go back and say, here's the questions that got asked today. What do you think about it? So I was living and learning in a place where there were different systems of knowledge, different ways of orienting to the world. So I would get these wonderful questions and I would get these very, very diverse perspectives about how to think about it, how to action it, how to move it along. I think that was a real privilege. Anytime we can connect with community, anytime we can connect with mentors and teachers, and those can be peers as well, it's very important because we can learn so much. So I had those gifts, and those are real gifts given to me. And I took them. I welcomed them because I knew that they would form the foundation for a lot of the work that I would do as I began to lead some of these centers, as I began to undertake research with different people and on my own. I think that was really, really important. My commitment to children has never left. Children and families, and my commitment to working on behalf of my collective has never left me. I am in a variety of many different arenas, both Indigenous and non-Indigenous, but we all have a role to play. I truly believe this in the health and well-being of all people, and I will speak from my place, which is an Indigenous place, and I will say for Indigenous people as well. I think that those things, and I just want to share 2 or 3 practical things, and I don't know how I'm doing for time because I have no sense of it once I start talking. So I was just having conversations with the federal government last week when I was in Ottawa, and they were asking me about some work that they had done, and I said to them, there's a couple of pieces or rules that I keep in my head when I'm doing research or I'm working in community or I'm working with people from diverse cultures. I always say, and particularly talking about our folks, I will say, how do we privilege their voices? Those voices that have not been heard or that have been silenced, how do we privilege voice? How can I do that in my small way, in my little piece of work? How can I do that? You know the answer to that. And then the other piece I said, we never take someone else's voice. We never take it. They may give it to us, and we must honor that. I've been given up many stories in my life. I've written about them in my PhD. I've written about them in books. I talk about those stories that are shared with me. Always really important to share where those stories came from. In that way, I honor them, and I don't take their voice because I honor the teaching. And those things, every time you read a book, someone's teaching you. You are in relationship with it. So that leads me to my third point, is that for me, research, teaching, all those kinds of things are relational. I am in relationship with you as a person. I am in relationship with knowledge. And I treasure and honor that. It needs to be respected. And I was reminded, and this will be my last point, Margot, I was reminded of that. I was thinking, and I think it was in was the late 1980s, so that's aging me just a little bit. I wrote a paper, and it was called the Importance of Visiting. And I had been in a number of First Nations communities across the country who were not my communities, but I was welcomed in by a number of people across the country. And I remember I wrote a journal about those experiences and the research that I was undertaking at the same time. And I think what I learned then is equally important today, but you're not probably going to pick up a methods textbook and see the power of visiting in it. But I got to tell you, those experiences are what you're going to live. They may not have the textbook word, but how you are in that relationship is the piece that's important. And oftentimes when I was in the communities, they'd say, oh, come on over for a visit. We'll have a cup of tea. And I learned more having a cup of tea than I ever did sitting down with a questionnaire. So I will leave you with that and stop. And
Thank you very much, Margot. The language of those things which are normally invisible here is really powerful. And thank you for just surfacing things that we just don't often spend enough time thinking about. So, Dr. De Leeuw.
So, being the last person in a group like this,
It's awesome.
It's not awesome. It sucks. My heart is flipping. I've sort of got floppy things in my stomach, but I'll offer a quick summary before I say something independent, and that is that listening to Margot Greenwood, to Henry Harder, to Doctors Greenwood, Dr. Harder, it strikes me that they're sort of touching on 4 or 5 key things, which are also fundamental to my own journey toward thinking about Indigenous health. And those things include place and identity. They touch on the fact that these are complicated, messy, very personal topics. But they also talk about mentorship and relationship. So to tell you how it is that I ended up in a faculty of medicine, which, by the way, when I got the call from the people who were inviting me for an interview, I thought they had the wrong number. I don't have any doctors in my family. Nobody has a PhD. I've got street cleaners and alcoholics and like the odd person who is a teacher at school. There's nobody in my family who focuses on health research. Most people in my family don't know what I do. The notion of calling me Dr. De Leeuw is funny. Like a doctor is somebody you see at a hospital. That's the only thing that a doctor is. I grew up on Haida Gwaii on the Queen Charlotte Islands, in Port Clements and in Queen Charlotte City. And then I moved for my final 2 years of high school to Terrace, In Terrace, I went back to, I coordinated a women's center in Terrace for years. I worked as an anti-domestic violence counselor. I worked with Planned Parenthood, did a lot of work in First Nations communities surrounding Terrace. I was witness and privy to the signing of the Nisga'a Treaty, the first modern day treaty in British Columbia, in Canada actually. So I grew up very embedded in conversations about violence, about white Euro settler power. I've always approached questions about fairness through a feminist lens. Margot likes to tease me. She says, she doesn't know what to do when those young girls want to talk about that F stuff. So she says, well, we'll dust you off and send you out to talk about that stuff. And just to fully acknowledge that and to not make it sort of a flippant joke, I think a lot of Indigenous women are uninterested in the concept of feminism. And so as a sort of, righteous, pull up my feminist bootstraps kind of a gal, that sort of like, well, why wouldn't you be? And I think I say that in a very serious way because I think sometimes our own sense of wanting to do good and thinking that we have an answer to something, including in the realm of Indigenous health, can stand in the way of building and listening to the relationships that are offered to us. But I went back to school also very haphazardly. I was married at the age of 15, was essentially a ward of the state. I don't think I ever would have gone to university had Child Welfare Services not said to me, you can have all kinds of loans. They didn't tell me I had to pay them back. And I was like a little befuddled when that came about. But I had no clear sense of a linear way to get into the realm of Indigenous health research. And I think that that's an important thing. As somebody who's now in a faculty of medicine and working with future healthcare professionals and physicians of tomorrow, I'll speak a bit about that when I talk about sort of my own interest in Indigenous health and well-being. But I think especially Euro white settler colonial presences often try to address relationships with Indigenous people in a very instrumental way. We sort of think, well, we'll have a series of ticky boxes, we'll approach it almost in a quantitative way. And that kind of makes, I'll speak for me, but I think sometimes that's an effort to make ourselves feel good about things. Because then we've got it all wrapped up, we'll have it solid, we'll answer things, we'll tick off things, and then we can move forward. So my overall orientation to questions about Indigenous health and Indigenous well-being is, first of all, that my principal role is unsettling white normative colonial power. That's who I am. That's the best place for me to start actioning what I think about. So, for instance, I would never presume to tell Violet that I know a thing or two about her best interests. How ridiculous is that? I don't, And I have to say very honestly, mentored in a remarkably patient way by people who are not much older than myself, of course, but Indigenous people who I am daily thankful to for friendship and honesty. And that's outside of some sort of instrumental professional relationship where I sort of, go and ask a series of questions and learn something in a kind of, it's a 2-decade-long unfolding of friendship. And I really think as non-Indigenous settler presences, particularly in BC, that's a 97% untreated, unceded, legally associated with First Nations territory in this country. As non-Indigenous people, and there's also a racialized component of this, not all settler British Columbians are white, and I think we do need to grapple and recognize with those kinds of contributions and those discussions, and I think that those inform the way we approach questions of Indigenous health and Indigenous wellness. But as somebody whose father was born in the Netherlands, my opa and oma came to Canada fleeing Nazi-occupied Germany. As somebody with lineage and genealogy that stretches to the Netherlands, I think we need to ask ourselves very seriously what we are doing to unsettle colonial power. And to go back to what Henry was saying, that's very different. And to what Margot was saying about taking story, that's very different than, for instance, me saying I use Indigenous methodologies. Margaret Kovacs has said absolutely unequivocally, she didn't say this actually, but I'm paraphrasing. She said, white girl, you can't actually use Indigenous methodologies. Indigenous methodologies stem from a lived experience, from a genealogical cellular orientation to particular issues pertaining to health and wellness and knowing and being. So I wouldn't presume to take Indigenous methodologies. I do think, however, that particularly as a non-Indigenous person who is nothing but a visitor, an illegal visitor in many ways, let's be clear about that, we can start addressing fundamental inequities, which are the drivers behind Indigenous people being the poster kids of health inequities in this country. We can make effort to unsettle our own relations to the kinds of power that we continuously wield, which brings me right back to having grown up on Haida Gwaii, Queen Charlotte Islands, and in Terrace. My mother will tell you, and Margot knows my mom really well, so she would agree with, which by the way is a disastrous thing. If you become really good friends with somebody and then they become friends with your mom, it's like suddenly you have two moms to nag you all the time. Nothing unsettles you more than two moms. But my mom would say from a very early age, I was preoccupied with fairness. I really dislike unfairness. Like it just rankles me the wrong way. How come some people get more? How come some people are crapped on and other people aren't? And I think that that should matter to anybody living off the spoils of colonial conquest in this province. I really do. And I think it's up to us to name the position that we are located in order to unsettle the inequalities that lead to the kinds of questions that determine health inequities in this province and beyond. And I can say unequivocally that my orientation in coming to those questions are anchored in where I grew up, are anchored in the generosity of Indigenous and non-Indigenous people, but mentors who have offered me decades of their lives, and I'm speaking very specifically about somebody like Margot Greenwood here. I think we need to go out of our way to unsettle business as usual, because to be frank, business as usual is not working for any of us. And I came to those questions and those convictions and those beliefs partly through growing up in northern British Columbia alongside many of you and your families, and knowing every day that there's resilient unfairness, and that unfairness is something it is my responsibility to address and to tackle. And I'm so thankful to do it under the guidance of extremely generous scholars and extremely generous people like I'm sharing space with today. So I'm also very thankful to you both.
Thanks, Sarah. You have segued very nicely to this next round of questions around preoccupations and priorities. You know, how do we move from, in some ways, Margot challenged us by talking about the importance of visiting, and I would, you don't have the luxury right now to be in conversation with these guys, but we have just heard stories, backgrounds, origins, places people have come from, things that have moved them, things that have impacted us, and the importance of those things for our research. This is not some frivolous aside. These are foundational elements in terms of how we conduct this work, and it then informs how we proceed. So the next round of questions, which will unfold in any which way that it does, but we wanted to, I mean, given the scope of work that we have on this panel, we could be here for days, but I've asked for some thoughts around priorities and real preoccupations, because there are real challenges ahead, and where people are landing in their own work, how that's manifesting for them, and where it's leading them right now. So Henry, we'll start with you again.
Thanks, Margot. Well, Sarah, I think you helped me to segue perfectly into what I wanted to say in this section, which is that when I was grappling with whether I wanted to take the research chair position, Rita and I talked about it, and she said, "Why would you want to do it?" And I said, "Well, because I want to spend it. I'm in the twilight of my career here. I wanted to spend whatever time I had left at this crazy colonial institution called the university to work with and to help primarily Indigenous students to get through all the crap and all the shit there is to get through at this institution or other institutions, and that includes the research world. So I see myself as being a bit of a nice way, I guess, would be an act like to do change. What's that word? Change agent. Change agent. Thank you.
Change.
Agent change. I have trouble with nice words like that because I basically see it as being a shit disturber.
You need a T-shirt.
So someone the other day said to me, after listening to me for a while, said, "Well, you're really a rebel with a cause." And so I do see myself that way, that part of what has to be challenged is how the academy makes decisions about everything, including who teaches, who has the expertise, who gets the research funding, how do things get paid for, all those kind of things. And I'm not kidding when I say universities are the most colonial institutions that we have as a country, and we need to challenge that. And so I want to add my voice to what Sarah was saying, and I know that Margot also believes that. She just hasn't had a chance to talk yet about this stuff. But that we need to challenge that. We can't just shut up and listen to it and put up with the same garbage over and over again. So to me, that also includes in the research world is actually honoring Indigenous approaches to research and functioning that way. And it's one thing for me to sit here as a full prof, not worried about tenure and promotion, and to make fun of how other people do research. But it's really, I do not do any research that does not originate in community. I just don't do it. I'm not a curiosity-based researcher anymore. Some people, when I say that, laugh at me and say, "Well, that's what you're supposed to be." And I go, "No, I gave that up years ago." That's one of the things that bugged me about psychology. Like, maybe it's because I'm not curious enough. I don't know. But I just couldn't live in that individual curiosity-based world. And in the Indigenous world, the research is all community-driven, and it is based on the needs of the community. It's not based on my needs as a researcher or the needs of the academy. And that includes going after research funding, and that's a bit of a dilemma when you have these federal agencies in particular making decisions about who gets funding and who doesn't. And while there has been some change in that, I still see that as being a very, I don't know, it's not just colonial in the sense that we're talking about now. It's racist, and it is misogynistic, and it is all those kind of things. And there have been some, I know Margot sits on a CIHR panel, I do as well, and you feel like you make some progress with regards to Indigenous issues, and then something else happens that makes you feel like you get set back 20 or 30 years. One example or two, I'll wrap them together. I was on a review committee looking at the Catalyst grants for Indigenous wellness last year. And those grants looked really good. There was a real concern about having the research done in community, for community, with community, a lot of the right kind of phrases. And there was a group of Indigenous people. It was a mixed group, and not just Indigenous people, who were adjudicators of those grants. So I felt really good about that. Then I went to another meeting where we were being asked to provide feedback to the Institute for Cancer and something, or I can't remember the name of that whole institute. Anyhow, because they had funding they wanted to provide for cancer research, and they were getting negative feedback from Indigenous communities. And so they brought us together and said, "Well, what's wrong with you people?" Sort of the message that came out to us was, "Why don't you want us to come in and do research?" Well, it was really simple. What they were saying was, "We've got some money. What can we do for you?" Right? They weren't saying, "What can we do with you?" or "What are your community priorities?" In fact, there was one community I could introduce them to where cancer is the #1 priority right now, but they need to think that way. They need to think to ask the community what it is the community needs. And so that's sort of the twist I'm taking on everything I do now. is that this isn't based up by with a community and for a community. I'm not interested in participating. So that isn't to say that I won't help. You know, maybe I'll broker something or I'll work together with the community, but that attitude has to shift. It isn't about researchers with money coming in, you know, and this is still happening. It wasn't that long ago. Margot, you probably remember too, like when UMBC was approached by some big pharma companies wanting to do pharmaceutical research in northern BC. And that was when some of the eastern universities were having ethical issues with big pharma and having trouble sort of accepting the money and the outcome and all that kind of stuff. And so they were looking around for people that were less ethical, I guess, so they came up here. But that was, you know.
And didn't find you.
You know, so that was problematic. But I was at a meeting where one of the guys says, well, we want to work in these Indigenous communities. Actually, I think he said Indian, but anyhow, these communities. He said, and I said, well, why? Well, because they're small, they're isolated, and they don't know what they're getting into. So that was still acceptable logic in that organization at that time. That's not more than 5 or 6 or 8 years ago. So when people say, well, you know, that kind of racism and that thinking doesn't exist, I call bullshit on it. That's still very much alive. So anyhow, 2 things. I don't know if I'm going to get another chance to talk after I pass it over here, but there's a couple things about research that have always bugged me since I was an undergraduate heading towards psychology and doing lab work and playing with rats and all that kind of stuff. And that was this notion that researchers always thought, well, I know what I'm doing with this. I'm predicting an outcome, so I know what I'm doing. And I came across a quote by, you know, a really strong Indigenous person, his name is Albert Einstein. You know, he said, if we knew what we were doing, it would not be called research, would it? Right? So to have an open mind and look at, well, I may not know everything. I might not be able to predict that. And this is where the curiosity actually comes in. So I can engage in some work with community, not being able to necessarily predict exactly where it's going, which, believe me, when you do community work, you have to be open to that, because I guarantee you it's not going where you want it to go. So the other one is a book that really changed me dramatically, and that was Sean Wilson's book, Research is Ceremony. And when I read that book, I read it all. I picked it up and I read it. Right, it's not a huge book, but I read it beginning to end, and really had a profound impact on me. And he and I have been emailing back and forth ever since. And in that book, amongst a lot of other good things, he said, if research hasn't changed you as a person, then you have not done it right. So to me, that resonated very strongly, because I'd been reacting my whole academic life to this notion of being a dispassionate researcher, being independent, having no influence on it, and not really being able to or certainly not being involved with your subjects and that kind of stuff, to the point where I am biased. You know, I just declare my bias in advance, right? So I am incredibly biased as a researcher. I'm 100% for community. Part of my subversive work is to take federal funding, you know, pretend I'm doing research, and really making good partnerships and making a difference in community on whatever topic that has to be. And then writing nice reports back to government that tell them that we did research so we get more money. So that's my privileged position right now as an academic, and as a senior academic with lots of experience and track record. I can get away with that. So that's how I see my role now, is to do that kind of stuff. And I think we need more people who are, when they get to a certain status of their career, I'm not suggesting a junior researcher do this, because that could get you into trouble. But I haven't been shy about telling CIHR this either, because they need to change their attitudes big time as well. So maybe I'll stop with that.
Henry, thanks for those fueling the change processes that you're reminding us that you've been through and that you're fueling. There's lots in there, and I'm really eager to hear from Margot now as we finish this second lap. Margot.
Thanks. So I just want to take off a little bit on what you said, Henry. The whole piece about learning, and I read Sean's book way back when as well, and I wondered, and when I spoke with other people who have done their PhD, I've often asked that question, so what was the most important part and many of them would say how much it changed them to have done the work. So I think research is a deeply personal place. And I think you'll find that as you do that work, any kind of research, you find that causes you to think about who am I in that process, and what's my role in that process. So I think that's a really important question, and one that will underlie all of your writing. The other thing is I'm reminded of a teaching that I think is in many cultures, but particularly in mine, is we are learners from the moment we're born until we leave. We never do know everything. And one of the pieces that really underlies is humility. If I know, I don't know, then it makes me a little more humbler when I enter into relationships. And that's a really important piece when you're talking with other people. I am, and I was thinking about that as I was coming up the hill, and I will get to some specifics here in a moment. But I am, in a couple of months, we are having a national gathering, and there will be First Nations, Inuit, and Métis, and non-Indigenous people in the room, including federal ministers and leaders of the national Indigenous organizations. So you know it's political. So I'm grappling with these gatherings have always been about creating a space and place for people with diverse perspectives to come together to share the gifts that each brings to the table and to think about how we can use those gifts to influence the health and well-being of Indigenous people in this country. As I was thinking about that and I was coming up the hill, I was thinking, it is the interactions or relationships of human beings amongst themselves and between themselves in which we face the greatest challenges. We are in relationship to the land, and there are challenges there. But so if we have a common goal, we all want to have optimal health and well-being, then how is it that we do that together? Everybody has a gift, everybody has a role. And I will say to Sarah, yes. Is there power and is there oppression? Absolutely there is. But is it power and oppression going to take us out of this? I guess I'm standing on the side of the fence that says we need to learn how we are going to live in harmony. I'm not, as human beings, I know the elders would say, go watch for the animals, go, where are the lessons from there? We create the kinds of challenges that we face, and I don't know the ways out, but I will be talking about that when I have this diverse group of people, because how do I honor and respect each as gifts, as having gifts to bring to the table? So I think about those kinds of questions, especially because I'm a lot in policy world now, and influencing big policy. Those are really important questions, and I'm very pragmatic. It's not a place, and this is one of my colleagues always says, is we're not in a place of unicorns and rainbows, but rather we are facing challenges. And so how do we do that? We upset the status quo. We interrogate it. We ask questions about it. But how do we do that? That's the relational piece. That's the place where different systems of knowledge come together, different ways of knowing and being come together. What is in that place? Because how we do that, does that just polarize us even more? Or do we find a place? This is the place of innovation. This is the place of change, of transformation. I'm living that in my role as Vice President, Indigenous Health, implementing the new relationship into the health system. We face those kinds of challenges. So that's an area, I guess, Margot, back to your question, priorities and preoccupations. I mean, I'm certainly in the world of policy, especially for children and families and health. That's the worlds I'm working in. I'm also, I will talk a little bit about, Indigenous knowledge to practice. I think that's, if we accept the assumption or the truth that there are different systems of knowledge in the world, and those are exemplified in cultures, then what does particular knowledge look like in particular practices? So, for example, the Collaborating Center is a public health funded center, and I remember the question that we've been asking for over a decade is what constitutes evidence? Like, contemplate that one. What is evidence? And that's a really good question to ask. And so then somebody comes along and says, well, Margot, what does that really look like in nursing practice? How do we know that? So we grapple with, and I grapple and think about those kinds of questions all the time. I have to say that knowing oneself and one's own values will anchor you in whatever place you are. Research, practice, policy, that's going to anchor you. You will look at that and you will reflect on that many, many times, because when it comes down to it, that's what guides you in taking action, in your thought, all of those things. So knowing oneself, and I think we've been saying that around the research part, is knowing that is really important. The National Collaborating Center, too, I have to say this, is all about knowledge translation. So that's related to research. It doesn't necessarily do primary research, but it certainly looks at all the other kinds of our research as we look to sharing that information. So our center is really focuses on Indigenous knowledges, Indigenous perceptions, Indigenous evidence around particular issues of health, and particularly determinants of health. We have a huge focus on that, and a huge focus on children and youth. So I'm in those arenas all the time. I'm in multiple arenas a lot, across many disciplines and across a number of sectors. So I'm going to stop there because I think it's getting close to time. So Sarah, take us home.
Seriously, sometimes I just want to give up, just to take us home. No, thank you for that small nudge, Dr. Greenwood. I'll end quite quickly, just and answer quite specifically my own preoccupations and priorities in the realm of Indigenous health research, and I'll riff immediately off of one of the things that Margot just asked, which was how do we interrogate power? How do we not go to a place that increases polarization? And as Margot knows, and certainly a preoccupation of mine in the realm of health research, is a sense that the creative arts offer us a remarkable landscape through which to interrogate power in a way that elevates, in a way that is celebratory, and in a way that prompts critical self-reflection, and in a way that doesn't necessarily need to be exploitative of existing Indigenous ways of knowing and being. I would encourage any of you who are interested in health research to actively read, and I mean like a book a week, and you'll be reading for the next 20 years, a novel, a book of poems, a movie, a play, anything authored or created by Indigenous people in the Americas and beyond. That's on the public record. That is a gift to all of us. It is an act of unsettling to read Lee Maricle's Raven Song and to understand a story not unlike Sean Wilson's research of ceremonies. Those are gifts to non-Indigenous people to further interrogate and understand our own positionalities vis-a-vis power, and hopefully elevate us to a place that doesn't result in increased dichotomous polarization, the kind of thing that Margot was mentioning. So that leads me right round to a very significant preoccupation of mine, which is to somehow ensure that the arts are given equal space and thought in health and medical sciences, particularly vis-a-vis questions about colonial power. I have to tell you, anti-Indigenous racism, I think, is an infection that permeates almost all corners of Canadian society, settler ways of engaging Indigenous people. I think it has to be interrogated. I'm an unabashed political creature. I think we have some fairly serious backlash movements to the far right across the Americas, across the world. And I think those things need to be addressed, because I think if they're not, we will see a resurgence of the kinds of dehumanizing fascist movements that history has told us never gets us very far. And I think marginalized people will always be at the cutting edge of that kind of backlash, that kind of resurgence of the far right and of fascism. And in this country, I guarantee you, Indigenous people will be facing that kind of frontline racist bigotry. And it's up to certainly those of us sort of working in this area to address that head on. I'm deeply preoccupied as a geographer with the way that proximity factors into questions of inequity. So I believe that more healthcare professionals ought to get out of offices in urban areas surrounded by people who speak the same language, and they need to be in community, the kinds of things that Henry was speaking about. And that's, an applied thing that I do with people like Margot Greenwood and the First Nations Health Authority. I put BC's future doctors into Indigenous communities at the invite of northern communities. Finally, I believe that health, and these are things that I've learned from my esteemed colleagues and people I'm honored to call my friends. Of course, health is far more than the absence of disease. Health is jubilation, it's family connection, it's happiness, it's a sense of self, it's identity, it's an anchoring in place. And those things, I believe, all touch on questions of emotion and affect and experience and feeling and almost a poetically embodied sense of wellness. And so it's an absolute preoccupation of mine to try to surface and privilege questions that are beyond the quantitative sort of modes of investigating well-being. It's about documenting the amazingness, the humor, the stories. And as a settler presence in the North, for me, that question maps on to a love of Northern British Columbia. It's where I grew up. It is where I feel most at home. It's where I own a house. It's where I come back to work. I think we in this room and at this university are at an incredibly important political and geographic and historical crux where we need to be asking questions about the treatment of people who haven't been treated well and who consequently are not as well as we all want everybody to be. And that's what I'm interested in interrogating with as many research tools as I possibly can.
Well, I did mention this was going to be a stunning panel, and we really appreciate just surfacing some of those preoccupations and priorities. I would like, if anybody does have a burning question, I really would love the chance for somebody to ask a question of the panel. We also do have the fact that you've got an amazing suite of resources over there to be looking at when you finish, and opportunities to be following up. But I do see a question up in the back. Yes, please. And if you could just, for the people that don't know you, if you can just introduce yourself quickly, and then we'll go to the panel.
Listening to all this, there are a lot of questions that come to mind. So I'll address the first one that really comes into my head. And I'm going back to what Sarah said about inequity and fairness, and the way to, in my experience, the way to try and approach these is to find common ground with different people. But start from something common ground, pretty much people in a way, so then we should help each other, type of thing. Anyway, common ground, education. Margot said something about education has a price. I was wondering, and I kind of have some idea of what, let's say, price could be, but I was wondering if she can say a couple of words about that. Because education, you said, and in my culture too, actually, it's good to educate, because yes, you improve yourself. It's a way to live better, for your children to live better. But yes, it does have a price. But I was wondering how do you see that?
I'll speak to that from my work in early childhood, and I'm actually just writing some pieces on this right now, but it really is applicable to any age. I guess it's recognizing, again, like I said later on in some of my words, recognizing that there are different ways of knowing and being and orienting to the world. So we have diverse collectives of people. So I'm going to move from the individual to the collective and back and forth here. And so one of the biggest questions that we ask in early childhood is about identity formation. And I think Henry was talking about that as well earlier. So if there's a considerable conversation going on right now about sort of how children, how do they come to know who they are? So when I was doing my PhD, for example, in New Zealand, I asked some principals, so what do you want children to know when they come into the school system? And one of the Maori principals said to me, I want them to know who they are and their language. I'll teach them about numbers and reading and English and all of that when they get here. So as we push down, because most education institutions use provincial curriculum, which recognizes diversity, but it certainly is oriented to a particular set of assumptions. As we push that further down into communities, so we start to look at 5-year-olds, 4-year-olds, and say Indigenous communities. That is not necessarily congruent with their cultural way of knowing and being. So you have a real dilemma there. And that's why I talked about myself having the privilege of being able to move in multiple worlds, because I could be successful in my own community, but I can also be successful in the academy, for example, which is a different orientation to where my community is. So that's what I'm talking about when I say we cannot afford to lose our identity. We cannot afford that. I mean, we have to look to history to see this. I'm not going to go into the colonial experience and residential schools and all of that, because I'm assuming you know that. The history of Indigenous people in this country. And part of that was to totally assimilate. So today we have these conversations going on. And I remember when I was doing some of this national work, it was in the early 90s. I remember an elder, and we never had early childhood services on reserve. And I remember one of those elders saying to me, Margot, are we just pushing residential schools now down into the hearts of our communities? A very good question, one I've never forgotten. So we ask ourselves when we come to the academy, like I was extraordinarily privileged to be able to be in the academy learning what I was from very informed and knowledgeable people, but also able to have those questions and talk about those questions from a community perspective or from a different system of knowledge. I was extraordinarily privileged to be able to have that. And so that's what I say when I say, at what cost? At what cost to me individually, and at what cost collectively? We always, marginalized people, always must be on guard around assimilation. That's what I was talking about.
So we're coming to the end of this very thought-provoking panel, guaranteed to leave us with more questions than answers. I think, is there any other, we probably have one time for one more question. I certainly have many. Oh, thank you. Yes, please.
So this may be hard to answer, but we'll try. As a settler myself, wanting to find ways to engage, to unsettle, what is the best way to be able to, like, is there opportunities to connect, to engage with the kinds of work that people like yourselves are doing here in this community on campus to be able to contribute in some way to that process and I don't know, I guess it's the easiest way to ask the question.
You go for it, Henry. Come on.
There is a cost of working with these two. I was going to say Sarah is a really good example of that. I think that it made me think, your question made me think of the work that, can I use your name?
Yeah.
Anita Shaw and I are doing, looking at decolonizing psychology. And how do you do that? And it started from the perspective of trying to, or to deal with the people saying, well, you need to indigenize psychology. And then looking at that and throwing that out and saying, you can't indigenize it, you got to start over again. So how do you decolonize it? So how do you engage in that? And I think that that would be my metaphor for answering your question around, you need to get involved, you need to ask questions. In that course, we were talking about how do you address racism? And we decided not to address racism. Mm-hmm. We're addressing whiteness, the white privilege kind of perspective. And within that, the racism question. So we need to self-reflect, we need to think about what we're doing, and then how we're engaging. And to participate in events like this. Like when Margot was talking, it really made me think about, like, it's become paramount in my life that I identify as Indigenous, which is why I started the way I did. Because I can pass. And so people look at me and go, well, what the hell are you talking about? So they need to know where I'm coming from on this and what my perspective is. And I think it's the same for the settler community, is to think about where they're coming from, what kind of privilege has been engaged in that. I was privileged. I mean, I grew up in a Mennonite household, a very abusive household, but nevertheless, it got me access to education, for example, that I was of the age that would have been in residential school. So it's kind of a weird thing. Like on the one hand, it's privilege, on the other hand, it was really abusive. So how do you deal with that? And I think the same question from the settler perspective, because I've been asking that from both sides, literally, because they were settlers. So how do you do that? You have to ask the questions, be comfortable in your own skin, looking at how do I do this and what's my privilege and how can I address that? I don't know if that.
I guess it's funny. I was just in Comox, Cumberland, at a big poetics festival, really interrogating settler relations to ecosystems through the arts. And It was amazing to me how many settler people really wanted kind of an instrumental answer to how do I do this better? And I guess, and I really appreciate your question. I mean, I think there are really practical things like, go down and volunteer at the Native Friendship Center and just like do something worthwhile. Like just go and, I don't know, like go to the First Nations Center and like tell somebody you'll help them write a thesis. Cause I guarantee you there's a graduate student who needs help writing a thesis at one point or another. Nobody in this room, of course. But I also think approaching these things in an instrumental way, i.e., how can I sort through my settler anxiety? What do I need to do to get that answered? Is in some ways never going to address it. In some ways, I have a friend who once said, you can't choose a pet chooses you. I think if you are of open mind and open heart and making an effort to listen and to in a really responsible and ethical way not go out and do this for a certain purpose, i.e. I am going to go into this community and ask a series of questions so that I can get the answers that are going to make me understand. Shirley once said, Shirley's a woman from Nunavut that we work with. She said the most fundamental thing about Inuit storytelling is that the listener will only hear the message when the listener is able to hear the message. Yeah. It has nothing to do with the story. The story will be repeated and you will get a different message from that story every time. And it's up to us to hear the story each and every time anew. Because the story itself may not be significantly shifting. How we hear it, and as long as we don't approach it in an instrumental way, like, oh, good, I've heard that story, I got it. Oh, okay. If that's the way you're approaching this, I would venture a guess that we're approaching it incorrectly. I think it's just hearing the story and going and finding the story and not going and saying, could you give me that story so that I could get the answer at the end of it that I need to hear? You'll miss the importance of the story. So I think it's up to all of us, especially in a place like, an institution of higher learning, to be open to the stories and to not approach them in an instrumental way, for what that's worth.
Thank you, Sarah. And thank you, all of you. We have reached the end of
our... one more thing to say, Margot.
That's good. We are reaching the end.
We haven't quite ended.
I have to do the public advertisement here.
That's true, yes.
All three of us, plus Tina Fraser and Judy Thompson, are part of an Indigenous mentorship network of the Pacific Northwest. And this is an opportunity for student mentorship. And that's not just us here at the university. And so we want to grow that with faculty, but also it gives us opportunity to connect with other faculty mentors at other universities throughout British Columbia. And there's also student awards. So watch for this. We'll be putting out more information about this. So please pass this on to your peers and to students in the university. So we're all connected. So if you are part of this, so if you want to connect with any one of us, we can get more information. And we will be bringing out more information, but this was an opportunity while you're here, so to share that. Thanks, Margot.
Well, thank you. And we at 2:30 on the dot, as far as my clock goes. I really want to thank you for being here, but I especially want to thank this panel. And I would argue we've had an opening to the new health research seminar series that will hold in your mind for a long time, and I really encourage you to reflect on it. You asked for tips, and Sarah and others have given one: the importance of visiting and the idea of reading. Reading non-fiction books by Indigenous by Indigenous people, and by considering identity. I mean, we've had so many tips here as you comb through what you've heard about, and to carry that in the sense of not expecting the answer to come from outside, but that we've all got a journey to go on here, and we've been given a lot of really, really helpful things, not just about Indigenous health or Indigenous health research, but about research in general, about universities in general, and also about being people at this time and this place. And so I really encourage you to use this fuel in whatever you're doing, figure out ways to do it and to keep learning, but also to come back for some very different but also really diverse and interesting fuel for around health research at the other seminar series. So Margot, Henry, Sarah, and all of you, those of you online, and those that made this come to life, thank you for being here, and we'll look forward to continuing these conversations. We have a
Like when Margot was talking, it really made me think about, like, it's become paramount in my life that I identify as Indigenous, which is why I started the way I did, because I can pass. And so people look at me and go, well, what the hell are you talking about? So they need to know where I'm coming from on this and what my perspective is. And I think it's the same for the settler community, is to think about where they're coming from, what kind of privilege has been engaged in that. I was privileged. I mean, I grew up in a Mennonite household, a very abusive household, but nevertheless, it got me access to education, for example, that I was of the age that would have been in residential school. So it's kind of a weird thing. Like, on the one hand, it's privilege, on the other hand, it was really abusive. So how do you deal with that? And I think the same question from the settler perspective, because I've been asking that from both sides, literally, because they were settlers. So how do you do that? You have to ask the questions, be comfortable in your own skin, looking at how do I do this and what's my privilege and how can I address that issue. I don't know if that.
I guess it's funny. I was just in Comox, Cumberland, at a big poetics festival, really interrogating settler relations to ecosystems through the arts, and it was amazing to me how many settler people really wanted kind of an instrumental answer to how do I do this better? And I guess, and I really appreciate your question. I mean, I think there are really practical things, like, go down and volunteer at the Native Friendship Center and just like do something worthwhile. Like, just go and, I don't know, like go to the First Nations Center and like tell somebody you'll help them write a thesis. Because I guarantee you there's a graduate student who needs help writing a thesis at one point or another. Nobody in this room, of course. But I also think approaching these things in an instrumental way, i.e., how can I sort through my settler anxiety? What do I need to do to get that answered? Is in some ways never going to address it. In some ways, I have a friend who once said, you can't choose a pet chooses you. I think if you are of open mind and open heart and making an effort to listen and to in a really responsible and ethical way, not go out and do this for a certain purpose, i.e., I am going to go into this community and ask a series of questions so that I can get the answers that are going to make me understand. Shirley once said, Shirley's a woman from Nunavut that we work with. She said the most fundamental thing about Inuit storytelling is that the listener will only hear the message when the listener is able to hear the message. Yeah. It has nothing to do with the story. The story will be repeated and you will get a different message from that story every time. And it's up to us to hear the story each and every time anew. Because the story itself may not be significantly shifting. How we hear it, and as long as we don't approach it in an instrumental way, like, oh, good, I've heard that story, I got it. Oh, okay. If that's the way you're approaching this, I would venture a guess that we're approaching it incorrectly. I think it's just hearing the story and going and finding the story and not going and saying, could you give me that story so that I could get the answer at the end of it that I need to hear? You'll miss the importance of the story. So I think it's up to all of us, especially in a place like, an institution of higher learning, to be open to the stories and to not approach them in an instrumental way, for what that's worth.
Thank you, Sarah. And thank you, all of you. We have reached the end
We
of
have one
our...
more thing to say, Mark.
That's good. We are reaching the end.
We haven't quite
I
ended.
have to do the public advertisement here.
That's true, yes.
All three of us, plus Tina Fraser and Judy Thompson, are part of an Indigenous mentorship network of the Pacific Northwest. And this is an opportunity for student mentorship. And that's not just us here at the university. And so we want to grow that with faculty, but also it gives us opportunity to connect with other faculty mentors at other universities throughout British Columbia. And there's also student awards. So watch for this. We'll be putting out more information about this. So please pass this on to your peers and to students in the university. So we're all connected. So if you are part of this, so if you want to connect with any one of us, we can get more information. And we will be bringing out more information, but this was an opportunity while you're here, so to share that. Thanks, Margot.
Well, thank you. And we at 2:30 on the dot, as far as my clock goes. I really want to thank you for being here, but I especially want to thank this panel. And I would argue we've had an opening to the new health research seminar series that will hold in your mind for a long time, and I really encourage you to reflect on it. You asked for tips, and Sarah and others have given one: the importance of visiting and the idea of reading nonfiction books by Indigenous by Indigenous people, and by considering identity. I mean, we've had so many tips here as you comb through what you've heard about, and to carry that in the sense of not expecting the answer to come from outside, but that we've all got a journey to go on here, and we've been given a lot of really, really helpful things, not just about Indigenous health or Indigenous health research, but about research in general, about universities in general, and also about being people at this time and this place. And so I really encourage you to use this fuel in whatever you're doing, figure out ways to do it, and to keep learning, but also to come back for some very different but also really diverse and interesting fuel for around health research at the other seminar series. So Margot, Henry, Sarah, and all of you, those of you online, and those that made this come to life, thank you for being here, and we'll look forward to continuing these conversations. We have a lot of fun.
Thank you.
Thank you.
Okay.
Well done.
Thank you.